you've been using this since 2002. It's been quite a bit. And there's a lot of research on this. I mean, I was at the ISLA conference in San Diego with Dr. Weber and yourself and heard all this. There's so much science about this going back to, decades ago, really, with photobiomodulation. There's so much out there that's so interesting. But from your clinical perspective, using it for 20 plus years now, what type of patients are you using and what are the results you're seeing?
Well, and as far as this long-term use of the laser, a lot of our laser use in our practice was topical use, to be honest with you. Back in the day when I was using a fairly decently powered low-level laser therapy in the late 90s and early 2000s, if we were treating stuff on the brain, we were more thinking about, hey, listen, we're looking about treating, a head injury because that's also affecting the neck. So working more on the fascial level, how these things began with. And so initially saw a lot of soft tissue changes where you work on the back of someone's occiput, which is the backbone here of the cranium, and releasing that tension in the neck that had happened, say, from a car accident, or they had an accident in a pool where they hit their head on the bottom of the pool, and those sort of things. And I'm also an acupuncturist, and so I have used acupuncture itself specifically on the brain for many years in patients. To treat, outside of, say, injuries, also things like anxiety or depression in these patients. And, the big caveat with, anxiety and depression is to make sure that we're looking at, what are some organic causes of those things first, just to make sure we're not missing anything. Because, just because someone's having depression doesn't mean putting a helmet on the head is going to change that right away. Maybe the situational things taking place, maybe they have low vitamin D. Maybe they have low thyroid function known as hypothyroidism. They could be low in B12, or they could have actually had, a traumatic brain injury or a concussion. And those are kind of the big areas that I've seen very interesting work with, because my experience with using any type of laser on my head really started about 9 years ago. I went to a conference on mental health, and it was integrative. And at this conference hall is this laser device for the head, and I was like, okay, what's this? I love lasers. So I walked over started talking to the gentleman, and it was, I tried it out because I was very curious and I'm real sensitive to things. And I walked away and I was like, okay, I knew something should take place. I just know what I would be experiencing. And I felt just more calm, and they were using a specific frequency on that particular device at the time I used it. And it was more like calming, and I wouldn't call it more like meditative. But the big things, getting back to your first question, I just want to give you the kind of background a little bit there, are TBIs, strokes, usually ischemic strokes. That means, lack of blood flow, not a hemorrhagic stroke, and mild to moderate dementia in patients. And we're often trying to do those things in our practice currently in the last 4 or 5 years in combination, where we can enhance the effect. And so one example of that we're using is we work with hyperbaric oxygen therapy. And so in that environment, if patients compress and breathe in oxygen at a high concentration, where we can flood their plasma way beyond what the blood itself could normally carry. And once they come out of the chamber, we then have them come over to the other side of our clinic and use the helmet. One of the reasons that we're doing that is that oxygen from the photoscience and photobiology research can make the blood more photosensitive. Because laser itself, we're talking about photon energy is what we're talking. And the last part of laser is your exposure to radiation. But in this case, it's photon radiation, which is not the same thing as a CAT scan, of course, or a PET scan. But we can enhance those effects. And even, certain supplements could affect this as well, as long as they can cross the blood-brain barrier. Like you could give somebody, riboflavin wouldn't be a good choice. Riboflavin is going to be better for intravenous laser, but using methylene blue, for example, that is a pigment that can cross the blood-brain barrier and is much more photosensitive for infrared and red laser in this case.
Yeah. You mentioned something like a methylene blue, and you're using this in a clinical process for serious conditions of the brain, but let's even go to those that are trying to optimize. A lot of biohackers love their blue tongues and optimizing their brains. That combination, like you're saying, the combination hyperbaric with this, but that combination of methylene blue, of other things, and And in an optimization way, would the helmet or a transcranial photobiomodulation help with that? Because we're talking like, hey, clinical process, it's helping heal the brain
Yeah.
in different ways, the lymphatics of flow. But what about the optimization of the brain?
I don't see why it would not. I mean,
Right,
I myself, the first time I used some of this technology wasn't really looking to heal anything.
right.
Just kind of looking for an effect. What would I feel like? And it's almost like if there was, on computers we have now, but on TVs in the old days too, you have like a brightness, like you almost turn up the brightness is what I would
Yes.
say I experienced using it. And I've had a few experiences myself actually where I had some minor concussions where I did use it because I wasn't feeling myself. But outside of that, for optimizing the brain function, absolutely.
Yeah.
As a
No.
question of, I think it'd make a big difference.
I'm a big fan of it as well, just for that optimization process of the brain and cognitive function and everything like that. And really have enjoyed using it.